And hello, everyone. Welcome. Thank you for joining us today. Good afternoon. We're giving just a few minutes for everyone to log on. We will do formal introductions in just a second, but we do want to thank you for being here to have a very casual, very open discussion with all of us here today about how we're staying resilient and connected to our community and our family members during COVID. So thank you so much. Para nuestra audiencia en español, por favor, por favor regrese a las 3:30. Vamos a volver a dar esta información en español. Así que muchísimas gracias y vamos a comenzar en unos minutitos. Brenda, are you here?
Hi, yes, I am. Hi, Francis, how are you?
Good. Welcome.
Welcome. Thank you for being here with me today.
Thank you. No, we're really happy, both of us, to be here. So we are giving a few minutes, but we are live and ready. So we'd like to just get the conversation started with what areas of San Mateo County or the Bay Area are you representing here today? Where are you from and how are you feeling on this Friday? So we'll give just a minute or so to get some comments. Brenda, where are you?
Yes, I am in Hayward right now.
Oh, okay.
Reporting from Hayward, but I work in San Mateo.
Yeah, I am also in the East Bay and virtually working in San Mateo.
Let's see, have we heard from anyone? Oh, I see that we have someone from Redwood City. Yay.
Welcome.
Hometown, Cupertino.
Granada. Oh, we have like.
Oh, Granada.
I always forget how big San Mateo County is.
It's huge. Well, thank you all who are already here. Thank you so much for joining us. Francis, how about we get started? Let's start with introducing ourselves and what brings us here today.
Let's do it. So absolutely. So officially, welcome. Again, my name is Frances Lobos. I use she, her pronouns, and I work for the Office of Diversity and Equity in the Behavioral Health and Recovery Services Department of San Mateo County. And today I'm here as a co-chair for the Diversity and Equity Council, which we'll define shortly. And with me here.
Yeah, hi. Yes, so my name is Brenda officially. My official introduction. My name is Brenda Nunez. My pronouns are she, her, and hers. And I work for Star Vista's Crisis Center as a program coordinator for our Health Ambassador Program for Youth. And I am here also as a DEC co-chair. And I know not all of us are familiar with DEC. So let me tell you a little bit about DEC. The Diversity and Equity, DEC stands for Diversity and Equity Council, and it's one of the HEIs with the Office of Diversity and Equity and BHRS. The committee or the council is made up of BHRS staff, partnering agencies such as Star Vista, and also other providers in the community and community members. Our goal really with Diversity and Equity Council is to address and eliminate health disparities in the county. Yeah, and I mentioned that the Diversity and Equity is one of the HEIs. Francis, do you want to tell us more about that?
Absolutely. Yeah, it's a lot of terms. If we can get the next slide with our lovely colorful hexagons. Awesome. So absolutely. So we are the Diversity Council, which is the first group located on the screen, but we're one of 9 health equity initiatives. And these initiatives are groups that are open to the public, that are made up of community members, of behavioral health providers, as well as community organizations. And we come together once a month to talk about what are some of the needs within each of these specific groups within the county, because we are a very diverse county. And so I believe on the slide also, if you click one more time, there should be a link there. One more time, please. There should be a link. Yes, if you would like more information on how to become involved, I encourage you to check us out and join one of our monthly meetings. These spaces are open, like I said, and the value of it is bringing the information from our community to our San Mateo County leaders to address the needs of our communities. So please check us out. Next slide.
Absolutely. I think that, the HEIs do very important and valuable work throughout the county. And I'm wondering if we have any representation from the HEIs in the audience today. Feel free to send us a shout out on the comment box.
Shout out to the co-chairs.
Yeah, and how's everyone else doing? It's a very difficult time right now. We've been dealing with very hard times for the last few months, for the last 5 months. And we're dealing with a pandemic and multiple crises that are happening at the same time. And one thing that has been amplified, or that we've seen during this time, recent months, is how disproportionately this pandemic has affected different groups within our San Mateo County community.
That's right. And I believe the next slide, we have some data. Really helped the DEC, the Diversity and Equity Council, really guide the work. So as Brenda was mentioning, we see here that depending on race, like there has been a disproportionate effect with COVID cases. And so we see the Latino Hispanic community specifically has had the highest rates of cases. And this data is from August. There has been some issues with the data collection, but this is the most recent data we have. And so given what we know and what we've been learning, the Diversity and Equity Council, along with other community partners, decided to convene and have an event, a virtual event on race and COVID to talk about what are some of these challenges. So on the next slide, we can see a visual of just the experience, right? So meaning disparities, challenges that we're all facing. And so we had a lot of takeaways. Brenda, I don't know what was the biggest takeaway for you, but we heard from community members during these events, and we also heard from county leadership.
Yeah, absolutely. During both our town hall events that we posted over the past few months, we definitely got to hear from both county leaders and community members. And I would say what was very impactful for me was hearing from the community members and how community members of diverse communities have been affected by COVID-19. And some of the things that we heard during that event were in relation to the concern of the continued group gatherings. I think that it's been difficult, right? Because we're social creatures and a lot of us really depend on each other for our mental wellness and just our wellness in general. So it's understandable that to many people, like if there was milestones happening during this time, it's hard to miss those, right? Things such as weddings and graduations. And then additionally, or I guess, another layer to that is like being invited to these events and having a hard time turning these events down and not be able to attend the events of our loved ones because we're concerned about their health and our own health. So it's definitely a challenge that came up during our conversations. And I'd like to hear from people in the audience that are joining us. How have you been able to support your loved ones without being able to attend to these events? In other words, how have you been able to say no in a way that's respectful and loving to your loved ones? So if you have any examples, I'd love to hear about them if you can put them in that chat box. We also heard from community members, and especially for our essential workers, is the hesitation to get tested for the COVID-19. And this has to do with the fear of losing a job or not having either paid time off if the tests come back positive. So that's definitely been something that our community has been facing. And then additionally, I guess to add one more thing is that the fear of the symptoms possibly being present and not being able and being hesitant to miss work because they don't want to be, they feel like they could be replaced or that they could lose their job if they take some time off to recover. Yeah, those were some things that we heard directly from community members. What about from our leadership, Francis? Do you want to highlight some of the things that came up?
Yeah, absolutely. So going back to the slides, on our next slide, we definitely highlighted the different things that are impacting health outcomes, right? So we know that only 20% of our health is directly affected by actual clinical care, while the rest, the 80%, like the rest of that graph, has to do with other, determinants, other social determinants of health, as they're called, such as economic stability, the neighborhoods in which we live, education, and so the social community context. And so part of this meeting, including leadership, was to talk about what is San Mateo County doing to support our communities during this time. So in the next slide, we have just some highlights that came out of that discussion with leadership that was present. So our Board of Supervisors in San Mateo County has been active and leading the recovery efforts by supporting financial support for childcare, for small businesses, creating an immigrant relief fund, as well as providing more support for hospital response, and most recently passing a resolution acknowledging Black Lives Matter, as well as declaring racism as a public health crisis. And so there's a lot more to come, and we'll be sharing. You can see the link below where you can find more information, but the county has definitely stepped up and continues to gather a lot of the community input in order to respond accordingly to our community needs.
Absolutely, thank you.
Yeah, and I think that the next part, and this is why we're here today, to talk about resiliency and adapting and connecting with others, because we know what we're not supposed to do. We know that, we're maintaining our social distance, we are staying 6 feet apart, and, we know where we can find information, hopefully. I think the next slide has our 211 number to get the most up-to-date information. So we know that this is happening. But in a conversation with you, Brenda, we were thinking and talking about what are the things that we are doing well? What are the tools that we've implemented to stay resilient and to stay connected?
Absolutely, yes. And this is why we're here today, because we're here to highlight and promote resiliency and strong connection with our community members and our loved ones. And as you said, we've already heard all the things we can't do. So what are some of the things that we can do during this time? And what are the things that we're doing? And as a way for us to learn about what community members are doing, we launched a poll earlier this month that was sent out to the co-chairs of the Health and Equity Initiatives to hear more about how they've been adjusting during this time and how they've been maintaining their connections.
That's right. And one of the initial questions that came up was, what are you doing as an individual for your own self-care? Like, what are you implementing? And those are some of the resources, and we'll bring that back up at the end. So don't feel overwhelmed to capture all the numbers. But what are you doing as an individual to take care of yourself? And what does that look like? And some of the things that we heard from our co-chairs are journaling, which I know you do, Brenda, and you have a fabulous, please show it. It's amazing. So journaling, walking, this has been an opportunity for me personally to spend more time in nature, which I don't usually do, but except for the air quality. But it's been an interesting time to think about what is self-care for me and what that looks like. And so we heard a variety of responses. How have you been doing, Brenda? And what are you doing?
Yeah, I think this time where we've been sheltering in place has really been a time for me to reinvent in the ways that I engage in self-care. I think that, and even they've changed a lot and they've consistently changed over the last few months. And like you mentioned, I think the thing that I find the most helpful is finding things that will keep me grounded, and writing on my journal has been very helpful. So I've actually completed a journal already during this time in the last 5 months. And, it's understandable not every day we're going to have the energy to journal and be inspired to write. So, and the days that I don't feel that way, I try to at least start my day with intention and set a list of things that I want to get done throughout the day, because that's helpful for me to guide me through the day and to help me stay grounded. It's important. I also was reminded of how important it was to stay in touch with my therapist. So reaching out to my therapist, I think, has been important as well. It's been the most helpful in reminding me to be kind to myself, and that, remind myself that we're going through a crisis and that I don't have to reach that level of productivity that I was reaching prior to shelter in place and prior to these crises.
Yeah, thank you for mentioning that. Oh, and we're getting a request for you to show your journal again.
Oh,
it's beautiful.
Should I open it? No, I'm not going to open it.
No, absolutely. And something that you said really resonated with me about not being too strict. I think at the beginning of shelter in place, obviously the stressors and just not knowing what was happening, I try to be very strict about what I needed to do and establishing a routine. But it's important to remain flexible and be kind to ourselves, as you mentioned, that not every day is going to look the same, that there's different strategies. I was just chatting with my sister, shout out if she's here, that she's been cleaning a lot more, and it just looks different for everybody. And so just remembering that personal, whatever it is that you can implement to ground yourself is is a good thing. And so for me, it has been walking, it has been spending unconventional time with family. Because of shelter in place, I moved back with my folks, and I've been able to spend more time with them than I would normally, right? Like just visiting on weekends or holidays. But now I get to watch Netflix with my mom on Wednesdays evenings. And it's something that perhaps I wouldn't have had the opportunity if the circumstances were different. So I'm grateful for that. And that is a silver lining.
Absolutely. And we know that the shelter in place and social distancing has also greatly affected our cultural practices. As we mentioned, we live in a county that is very diverse, and each culture has their unique traditions and celebrations. For a lot of us, these traditions and celebrations are essential for our well-being and maintaining our wellness. In the same poll that we mentioned earlier, we also asked our co-chairs, what are some ways that COVID-19 has affected these cultural traditions, and what have been some challenges that you faced?
That's right. And we got a variety of responses, from obviously isolation and not being able to attend like even religious ceremonies. You know, worship is such a strong coping mechanism, and faith is extremely important for many communities. And so that has been just a few examples. And I think we have a question about celebrating birthday while social distancing. I think all of us have experienced a birthday at this point this year, the last 6 months. And it's been challenging. I know that we live in a virtual world now, and we've done a lot of Zoom. I didn't celebrate a birthday, but I did organize a graduation party, virtual graduation party for my goddaughter, who graduated from middle school. And we just ended up doing something really sweet for her, where we just like did a Zoom party, and I showed some embarrassing pictures of her as a baby. And it was great. And so it's not the same. It's definitely a challenge, but there are ways to still support each other.
And I think because of the limited FaceTime we've had with each other, I think we really appreciate those moments of just sitting in front of the screen and sharing those happy moments and smiles and giggles and singing happy birthday while socially distancing. I would suggest also sending a gift, just sending a nice little gift. You can't give it to them in person, but I think that's a good idea. A friend of mine actually had a drive-through birthday party where they was decorated and stuff for their son. And so people just came, dropped off the gift, and just said hi. While being at least conscious of their distance between each other.
Mm-hmm. That's really sweet. Yeah, I've DoorDash meals to people. And so it's been really sweet to just get creative. Again, since we are about 20 minutes in, we want to just say hi, because I know that people are coming in and out. Again, my name is Frances Lobos. I work for the Office of Diversity and Equity, and I'm a co-chair for the Diversity and Equity Council. And we're here today talking about how we stay connected and how we are resilient, and we are continuing to build that resiliency during COVID. So thank you for joining us again.
Yeah. And then my name is Brenda Nunez. My pronouns are she and her. And I work with Star Vista as program coordinator in our crisis center. And then I am also the co-chair for Diversity and Equity Council. And kind of to go back to the question that came up, any suggestions on celebrating birthday while social distancing? I'd like to kind of put that back out there to everyone that's joining us today. What are some creative ways that you've been celebrating birthdays or any other important milestones? And I realized that not everyone's familiar with Star Vista. Star Vista, we're a huge nonprofit agency in San Mateo County. We offer mental health services and just support to everyone in San Mateo County, just ways for them to support and maintain their wellness. One of the programs with Star Vista is the Crisis Center. So we have the 24-hour hotline for San Mateo County. And so then we have different services under the Crisis Center, and I'm a coordinator for a Health Ambassador program for youth, which is a pretty neat program for young people between ages 16 and 24 who want to learn more about mental health.
And Brenda, I know you did the poll, also the same poll for youth. So yes. What kind of responses did you get around self-care and connection?
Yeah, so I think that a lot of the youth will really appreciate it. For the first time, they had a lot more time to spend with their family members, and a lot of it was doing activities with their family members. So doing movie nights. Some of the youth mentioned that they're having dinner with their family more often, almost every day, than compared to before, when everyone had kind of school schedule, sports, extracurricular activities going on. I know I can think of a youth who said they started making scarves with their mom, that their mom was teaching them how to knit, and they started making some scarves. And then also a lot of youth have really been taking the time to kind of reflect and see what works for them, what makes them feel better, what's helpful for them, what are things aren't helpful for them. I think social media is so big for all of us right now. I did hear a lot of you youth said that they've also been taking a break as self-care from social media. So just disconnecting for a few hours or a day.
Mm-hmm. Yeah, that's awesome. And I think we're getting another question, and this is a good one. What is your favorite family bonding activity during shelter in place? I'll let you go first.
Yeah. So right now I only live with my roommate. But I think that based on what the youth have said, it's really just sitting down and maybe watching a show together, which is something that they really didn't do before. Game nights were also very fun. I know that one of the youth, to connect with the younger kids in their household, they host craft nights. So they create different activities together or different crafts together.
Mm-hmm. Yeah, no, this time has allowed for so much creativity. One of the things that I'm doing right now is, because I'm spending a lot of time with my parents, is trying to cook. I don't cook, but I have this whole new appreciation for the dishes that I grew up with, that I didn't have access to. And so my parents are famous for the soups that they make. I don't like eating soups anywhere else, but I love homemade soups and they're amazing. And so my goal during shelter in place is to learn how to make oxtail soup. So, my mom's here. I promise I'll learn. So it's been really great. It's been really great to just share those bonding moments. And something else that we heard from our co-chairs from that poll is taking online classes. So one of our co-chairs is taking a comedy writing class in the evenings online, which is great. And I would have never thought that was offered online. So at this time, I would like to talk a little bit about the Office of Diversity and Equity, because we did a document, a PDF that we'd like to put up and display, as well as the link with different resources for wellness that can be accessible virtually, and you can go and sign up for classes, virtual museums. And so we want to make that available to everyone. But the Office of Diversity and Equity is an office within Behavioral Health and Recovery Services. And we do a lot of prevention and early intervention work around mental health and stigma and alcohol and other drugs recovery services. So we are a very broad office, and we work together alongside with the health equity initiatives, such as the DEC, to involve community and to bring the input and have that connection and really to improve our public health. So that's just the Office of Diversity and Equity in a nutshell. But if we can put up the wellness guide right now, I think that would be a great guide. We'll give it a couple of seconds, but this is accessible online on the BHRS website. And again, it contains links to different classes, physical activity that you can do with your family or on your own. And so we strongly encourage you to check it out.
And David Brown, we see that you're joining us. Thank you for being here. Hi.
Hello. And then finally, the last sort of portion of what we talked about with the co-chairs and the poll we did was around supporting our older adults and supporting youth. Many of us live in multi-generational homes, and each of us are facing this challenge and circumstances in many different ways. And so, that has been very interesting. Obviously, children in school and the whole dynamic has changed completely overnight. And so, what are some of the feedback that we got, Brenda, on your adults?
So the one that I am thinking about right now that I remember that I really like was, and I think this was an answer from one of the co-chairs, that they video chat the grandparent so that they can read to their grandchild over the phone or over video, which I thought was really neat. There was also someone else that mentioned that they are also, connected via technology, but also being more patient and helping older family members adapting and learning the ways of our technology.
Mm-hmm. Yeah, absolutely. It's been a learning curve for everyone. For children specifically, I don't live with children, but I have a goddaughter. I have 3 goddaughters, and I have one goddaughter that is 8 years old, and she's amazing. And one thing that I've tried is to do more arts and crafts with her. So I discovered, I love Pinterest, and I discovered fairy gardens. which are these really just creative pots, and you can make into this little fairy wonderland. And so we did that over the summer. She loves to do a lot of hands-on activities, and so we made it a point to do something in the open, in the backyard, where we got some pots and some markers, and yeah, we had a fun afternoon just planning things. And so it was a really nice way to bond with her, give her a sense of normalcy, and also to just get creative for a little bit. So I've really enjoyed that.
Yeah, and then other things that I heard from Hawaii Youth is spending a lot more time with their pets. And then also going outside to spend more time outside and with their pets as well. Going on hikes, that's something that was very popular. And also when it was safe to go out into the beach was also nice for those of the youth living in the coast, that they were able to hang out at the beach for a little bit as a way to.
Yeah, absolutely. And there's just so many things that we're dealing with, and it's just an enormous amount of pressure sometimes. And so we want to thank everybody here today, acknowledge that this is not an easy time, that again, we're all dealing with different circumstances, but we're trying to do the best we can to keep up with restrictions and do what we have to do to be safe. But also that we're not alone, that we have each other, and that we are resilient, that we are going to get through this. And there's many creative ways that we can learn from each other. So I'm going to make a second pitch at this point for you all, if you're interested, to join our health equity initiatives. Each initiative, as I mentioned, meets once a month. And this is the space for us to talk about these things. And so today we're here to provide you with information. I would like to put up, if possible, the link or the slide, with the links and the support lines. Thank you. Awesome. So here we are. Again, we're the Office of Diversity and Equity, Behavioral Health and Recovery Services, representing the Diversity and Equity Council today. And for non-emergency services, if you're interested in behavioral health or substance use services, we encourage you to call our Access Call Center. The number is 800-686-0101, and you are able to get screened and be connected to a behavioral health provider. Our website is also here, smchealth.org/BHRS. You can also find COVID resources around mental health. And if you would like to join our mailing list and just receive more information about the events we're doing and things that are coming up, please join our mailing list. The link is there below. And then Brenda, I'll let you talk a little bit about our emergency and crisis lines.
Yeah, so for emergency, of course, we have the 911 number for medical emergencies. And then we also have the crisis line, and which I forgot to mention earlier as a resource, or a tool for self-care if sometimes you just want to talk to someone, right? I think when we think of a crisis line, we imagine someone who's actively in crisis and thinking about hurting themselves, right? Which is not often the case. A lot of times we get calls for people who just want to check in and talk to someone. It's completely anonymous, and it's available 24/7. We on a separate resource, we also have access to the text line. So the number is 741, and you can text BAY to that number so that you can get directed and connected to someone with local resources.
Thank you. So we encourage everyone to stay connected, and also to remember that we do have language access. So we do have interpretation available. If you were to need, you or a family member, community member would need services in a different language, the county has language access services. So we highly encourage you to just stay connected and to seek out services if you need to. This is a very challenging time. And some other resources before we wrap up is an immigrant relief fund. So as I mentioned a little earlier, when we heard about the San Mateo County Board of Supervisors and their ongoing efforts, there was a relief fund created for immigrant community members. And so the link is being displayed now. So they are still accepting applications. So if you yourself or know of someone that needs this relief, that needs support, financial support, please go to this link and sign up for the application. So again, we are wrapping up, but there's still a couple of things that we want to mention. We want to encourage you to stay connected. We will provide all of these crisis numbers and information on the website. So please make sure to follow up. Also, we are in the month of September, and September is Suicide Prevention Month. and also Recovery Month. So our final slide has 2 more links that give you access to some of the free virtual events that are happening in the county right now. So please, spread the word and stay connected and check out some of these events. All these events are free and again, being offered virtually.
Yeah, and to keep getting information and staying in the loop, follow us on Facebook and Twitter for more resources as well. And that's at SMC Health. Yeah. And we want to also encourage you to continue to add any suggestions, any ideas on ways that you have been practicing self-care and staying connected during this time in a comment box.
Yeah. What are your 3 takeaways, Brenda, from today? Like if we had to summarize the tips into 3 tips, what would be your top 3?
I would say that even though it's a hard time and we're social distancing, it's possible to continue to stay connected and engaged with our community members and our family members. That's one. What about you? Second one?
Second one, I would say, I like what we talked about at the beginning, just staying flexible and being kind to yourself, that there is no one way to care, to do something, so just to be creative and to be kind to yourself, to take it one day at a time, and to understand that we will get through this and that things are changing every day, but that we are all here and doing it together. So.
Yeah, and I also, it's a way to continue to stay engaged and entertained and part of conversations. Remind you to go on a calendar for Suicide Prevention Month and Recovery Month because we have a lot of events going on and they are all being hosted virtually. And so you don't have to leave your home.
Yes, join us.
Yeah, thank you so much, everyone, for joining us today.
Once again, should we reintroduce ourselves before we go?
Yeah, let's just, my name is Brenda Nunez, pronouns she, her, and hers. I work for Star Vista, and I'm a co-chair for Diversity and Equity Council.
Thank you, Brenda. Thank you for doing this with me today. I am Frances Lowell, she, her pronouns, and also a co-chair for the Diversity and Equity Council. Thank you so much for being here today, for chiming in. Please remember to continue to wear your mask, to wash your hands, to maintain social distancing, and take care of yourselves. Take care of yourselves and stay connected. Please, we hope to see you at the next DEC meeting.
Yes, and just a reminder, we will have the same conversation again at 3:30 in Spanish.
Yes.
Awesome. Thank you so much, everyone. Have a nice Friday.
Happy Friday.